good evening, and welcome to Community Immunity. This is a series of Facebook Live broadcasts specifically about the COVID virus as well as COVID vaccines, particularly in how the Black community has been accepting and been getting vaccinated, the rates of vaccinations. And so we really have this series has been focusing on areas where that primarily have been focusing on areas that were lagging behind in terms of vaccine acceptance rates by African Americans. So we went all through the dirty South. We've been in Mississippi and Alabama and Florida and Georgia and all of South Carolina and everywhere in between. And our last show, we did Chicago, we did Detroit, well, Illinois and Michigan, but Chicago and Detroit, how we get down in terms of the Black community. And tonight, we're going to be we're going to be in our nation's capital. And so we've got a wonderful panel of guests, a variety of guests. They're going to talk about the vaccine acceptance. We're going to get some of those rates, and we're really going to kind of get into, we've got some local citizens there in the DC and Maryland area that kind of talk about what they're seeing, what they're experiencing with their friends and family, and a unique way of tackling the vaccine and COVID in area. So that citizen is going to be a wonderful, wonderful conversation. So I encourage you to stick around. But we've got a couple of instructions, and we always do about this time. We'd like for you to drop in the comment section. Let us know where you're watching from. We'd like to always know where people are watching us from. So please put that down, even though I ended that sentence with the preposition. Please understand that I'd like to know where you're watching us from and give us a shout out. If you have any questions, please make sure you put them in the comment section, because at the end of the program, we're going to have a panel discussion where your questions can be asked and answered from our esteemed panel. So before we pull on our first guest, what I'd like to do is kind of give you some of the rates that are going on there in the state of Maryland. Maryland is actually doing very, very well. That's 3.7 million people in the state of Maryland has received at least one dose. That's 62.6% of the population there in the state. And fully vaccinated is 56.9, or 3.4 million people. So that is a really good rate when you're comparing it to other areas of the country that are really behind. And so great job, Maryland. But in terms of the Black population, Black people are 32.2% of the population there in Maryland, and the percent of COVID cases, 31.2%. So it's right there in line with our population in the state. However, in terms of the percent of fully vaccinated in the state of Maryland, 23% of African Americans are fully vaccinated. So as you can see, there is about a 8 to 9% difference between the population percentage and the actual fully vaccinated rate. So we still got to do a better job. So I will want to say this, though. In terms of our history in this country and what we have endured in terms of from healthcare industry, from the government, and those two things had to come together to create the vaccine. I want to celebrate the fact that we've gotten 23%, right? And so I know we're saying that's below our number, below our population numbers, but with regard to the kind of the general mistrust that many African Americans have with regards to anything that the government says, oh, come get this. Healthcare has not been kind to Black Americans in a general sense. I think to get Black Americans to kind of push that off to the side and step up and get vaccinated, even at a lower percentage, is still very, very good. So I don't want to be all doom and gloom and kind of point that finger of judgment to Black Americans, because we're doing a great job in terms of getting the message. We could be doing better, yes, but we have done a great job to this point. So I'm going to shut up. Thank you for dropping where you are in the comment section. And I'm going to bring on our first guest, who's not a stranger to Black Doctor. She is the host of House Calls with Dr. Gigi. She's also the you run the Rodham Institute there at
that's right. That's
George
right.
Washington, DC.
That's right. The Rodham Institute.
Dr. Gigi.
Thank you so much, Mr. Ellis.
How are you?
I'm good. It's been a little minute since we've been on together, and I'm so glad that we're here today. Yes, you're right. The Rodham Institute is a institute dedicated to improving health equity in Washington, D.C. And I named it for Hillary Clinton's mom, who was my patient. And I just had breakfast with Hillary, by the way, today.
Oh, wow.
And she is so excited that the Rodham Institute is a partner of blackdoctor.org. And she's doing great, by the way. She looks a lot better now.
Less
She's,
stress. It's sometimes
yes.
relief of stress will do that to
Yeah,
you.
no kidding, no kidding. But I'm just very happy to be here. And just to tell you my medical background, I'm a general internist. And, before we came on air, I'm of the age where I did my training during the AIDS epidemic, where people were dying 100% death rate within 1 year. We're lucky that COVID is not like that, but we do have a problem. And you know what, Mr. Ellis, you are so right about us doing well, because the reality is we always talk about the history of the medical system, but it's not just the history, it's ongoing. The medical apartheid system as relates to Black people is real. That's not something made up.
Right.
And so I am glad that people are stepping up to get vaccinated. And the news, there's an urgency to getting vaccinated, because guess what? 80% now, they just released a report, over 80%. And I know that we've got people who are experts in this field that are joining us this evening, of the variants, or the circulating COVID, are the Delta variant, which is much, much, much more contagious. And you mentioned Maryland. In
Yes.
Maryland, there were 0 deaths in the
Yes.
hospitals for anybody that got the vaccine. That is a powerful testimony. So that tells us that if you get vaccinated, and it doesn't matter with which vaccine, guess what? But you have to get all, for the Moderna and the Pfizer, you get both doses. Of course,
Right.
Johnson and Johnson is one. Your chances of dying or being hospitalized or having serious, illness from COVID are substantially reduced. And
Yep.
so the message that we want to get out today was to remind people of this. But the Rodham Institute is a member of the Black Coalition Against COVID. We're on the steering committee. And just to remind everybody, the Black Coalition Against COVID is comprised of the 4 historically Black medical schools, labor, faith-based, education,
Mm-hmm.
hip hop, everybody, the alphas, I shouldn't call out just the alphas, the
It's
sorority,
fine.
the
That's fine.
fraternities,
You can
right?
just call us out.
Right? Kappa Q's everywhere. So, but the idea is that this organization really, it vets information.
Yes.
It's sort of for you, by you, from trusted resources, right? And what we're finding, collectively, I'm using the royal we for BCAC, is that the African American people like my age,
Mm-hmm.
we're doing at the same rate in terms of vaccinations as our white counterparts.
Yes.
The 18 to 45-year-old demographic, just in general, everybody, is the area that we need, we need to try to get everybody vaccinated. And I know that there are guests today that are going to talk and speak to that. But, we're going to talk a little bit more about the variants and why it is that there are so many, and why it is that it keeps changing. And I'm going to quote one of my dear friends, Dr. Melissa Clark, who's also on BCAC. And this is what she said. It's just very helpful for me to think about why these mutations happen. When you get an infection with COVID, the body gets turned into a COVID manufacturing plant. These viruses are so smart.
Right.
And so they're basically saying, okay, we're going to crank up production. And so when you have a lot of virus being produced, the quality might go down, right?
Mm-hmm.
We know that, when McDonald's first started, or something, I shouldn't say McDonald's, and now the quality changes, right? But that's why you have quality control. But what happens is that the virus starts to change, and most of the time that's not a big deal. But guess what? Sometimes it changes and becomes even more powerful, more infectious, and more deadly. So the more people who are out there that are infected, okay, who are not vaccinated, the more of a chance there is to develop not just Delta, but as we were talking before we came live, is that it could be Alpha, Gamma, Delta. We could go through the whole alphabet. Right. Which is really quite serious. And of course, like those horror movies where the monster gets much more, powerful at the end, and that's what we're afraid of it getting even more deadly.
Right.
Thank God it's not like HIV, by the way. Thank God that we're
Oh,
able to
yeah.
get a vaccine, because we still haven't been able to get a vaccine for
No.
HIV, and it's been, over 40 years now. So I think that this is sort of the universe or God or whatever your belief system is, to say, look, I'm doing this. I'm giving you a chance to get it together. But you know what? It could be a lot worse. So,
It's nature's warning shot. You get that warning shot before something bad happens. This is nature's warning shot. You've
yep.
got a little bit of time. It's giving us a window to get it together. Until that happens, we've got to make sure that we're getting it together and we don't continue to
Right.
infight. And I think that's really what some of the struggle has been, in terms of just making sure that we get the right information. Because I love the internet. It is a wonderful, wonderful place where you can get a lot of information. It's a repository of information. It's a place where information can be shared very easily. However, so can disinformation, so can misinformation, and it can create echo chambers. And so if you go down one rabbit hole, you may not be able to get out and then you get filled with a lot of disinformation. So what we've got to be careful about is making sure that we're getting the right information from trusted sources when it comes to healthcare and health related information.
And remember that some of this disinformation actually targets us. I'm sorry, my cat targets us. So,
Yes.
People talk about conspiracies. There is conspiracy, and I believe in conspiracies, right? I mean,
Right.
not all conspiracies are accurate, but, sometimes things are true and based on fact. But we should also think about who would benefit from people not getting vaccinated. Because if you remember at the very beginning of this pandemic with the previous administration, it was like, okay, they said people over 70, well, you've had a good life. They
Yeah.
said people with pre-existing conditions, well, who cares? And then, of course, we know that because a lot of Black and brown people were dying, right? It's like, who cares? And I'm going to just make the analogy that when HIV first came out, when I was in medical school, they would teach us, well, the people that get HIV are in the 4-H club.
Mm-hmm.
Haitians, homosexuals, heroin addicts, and hemophiliacs.
Yes.
So there's a different way about looking at this issue. And as my good friend, Miss Cora Berry, the former First Lady, widow of the Mayor for Life, Marion Barry, says, if it was something dangerous, why are white folks in line trying to get this vaccine?
That was an interesting thing, is when we talked to when we did the show in Mississippi, they were talking about Mississippi allowed anybody to come in. And so there were a lot of people going from Tennessee that they hadn't hit that level. They were going down into Mississippi to get vaccinated. Same thing was happening in Detroit. When we did the Michigan show in Detroit, they opened up the football stadium for a mass vaccination site, but they found that only 7% of the people that lived in the city of Detroit were actually going to that mass vaccination site. Most of the people were coming in from the suburbs, getting vaccinated at the mass vaccination site, whereas the city of Detroit is almost 75% Black. And so we've got to look at understanding that people are getting vaccinated. Urban hubs in areas have done a really, really good job. Some states have done a good job. California is almost reached. I think they've already reached herd immunity as a state. There might be some pockets that haven't reached it. New York, especially New York City, has done a good job in terms of reaching herd immunity. Chicago, a lot of the areas around Chicago itself have hit that first dose, 70%, that the president has asked to reach by July 4th. And so there have been some highlighted areas. Some of the things that we've looked at in terms of when we did some of the southern states it hasn't been hesitancy more so as it's been just barriers to being vaccinated. And so one of the key things, like in South Carolina, some of my family lives in South Carolina, and my aunt and uncle had to go an hour and a half to get to their vaccination center. They're retired, and so they were all on. So that's why they were willing to make that drive. But not many people are able to. You're talking about the working poor. Mm-hmm. They've got to make a decision. You talk about rural areas in Alabama, Louisiana, Mississippi, Arkansas, rural areas that don't get information as readily, and now you're bringing in government personnel from outside of the area trying to
Mm-hmm.
convince people to get vaccinated. They
Mm-hmm.
should be using more local personnel, more pastors, more local mayors to get that information out, trusted sources in those rural communities versus trying to bring in outside experts
Right.
to convince people. Because in the South
Yeah.
we tend to be a little bit more distrustful.
Well, but I mean, that's true of all of us, right?
Right.
So in DC, in Ward 8, which is predominantly African American, where, by the way, our rates of HIV are the same as Namibia.
Mm.
Just to give you an idea of what the health status is, and our infant mortality rate is the same as El Salvador and Cambodia.
Wow.
Ms. Berry had a vision to get everybody in Ward 8 vaccinated. We did a mass vaccination event, vaccinated 886 people, but this was the model, okay? We recognize that people have what we call competing priorities. If
Mm-hmm.
you're going to decide, well, I can't take time off, to your point of work. Yeah, I
Mm-hmm.
can't get to wherever. So what we did is that we all worked together. All the medical schools in Washington, D.C. came together, Howard, GW, Georgetown, Children's. We brought in Uber, free Uber rides. We brought in food. We brought in free daycare. We
Mm-hmm.
brought in, people coming in to make it as easy as possible. But this is what I loved. When you have people that look like you, that are taking care of you, right?
Mm-hmm.
That is so key. But what we did beforehand is we actually educated the 10 community-based organizations that work and serve the good people of Ward 8. So it wasn't me talking to people. It was the
Right.
people from Ward 8 that serve Ward 8 that got people signed up, that
Right.
made it the day. Actually, we got special dispensation to get walk-ups. People could
Yep.
walk up. We wanted to make it as easy as possible. Of course, to your point, in rural areas, the barriers are different and more challenging. But I mean, when people who are in the mainstream dominant society, they
Right.
take for granted that the messaging is all for them, right? We
Yep.
have to have special messaging for us,
We don't.
especially given sort of all the structural and social determinants of health. But I just want to say this, because to your point, Mr. Ellis, I think sometimes we highlight the negative, but there are success stories here.
Yes.
And one of the silver linings of this disaster of COVID, which it will result in about 650,000 Americans dead, right? We
Right.
haven't even talked about the people that have been disabled, is that organizations such as Black Coalition Against COVID, such as faith-based, such as community leaders, all these people are working together to really get the word out and to engage. And guess what? Someday COVID is going to be under control. We
Yep.
need to use that same model when we're talking about attacking cancer, child and infant, maternal mortality,
Right.
diabetes. So the silver lining is that COVID laid bare what we always knew, right?
Mm-hmm.
The inequities. Do you realize that here in Washington, D.C., the difference between the rich white folks and the poor Black folks in terms of how long people live, it's almost a 27-year gap, which is the highest in the country.
Wow.
So you live in Georgetown, you can expect on average to live 94 years. In Anacostia, it's 66 and a half years.
Mm.
And we know that 80% of our health outcomes actually have nothing to do with coming to see a doctor.
Right.
It's your education, it's the quality of food, it's the economic health of where you live, right?
Yeah.
It is the water that you drink, the air that you breathe, the quality of food that you eat. It's everything. It's the racism that, that is encountered and is embedded, right, in the very fabric of our society, right? So that is the one sort of glimmer. And I think that we as people who are servants
Right.
in the field of healthcare and really care about our people need to just continue. We've been doing this work, but really to kick it up a notch, right?
Absolutely. Well, I'm gonna give you a little bit of hope. One of the things that so that process is already happening. So recently, I did an interview with Kim Keck, who is the CEO of Blue Cross Blue Shield Association,
Mm-hmm.
and they have begun an initiative. They are determined to lower the maternal mortality rate of Black and Brown women by 50%. And so they have taken on that cause over the next 5 years, and they have taken on that cause. And so you can find that video on Black Doctor's website, on our YouTube channel, of that interview that I did with Kim Keck and their lead researcher at the University of Minnesota. So I think that tied in terms of eliminating some other disparities outside of COVID. When COVID shone that light on healthcare disparities, some companies are now stepping up and doing a great job. So I want to give Blue Cross Blue Shield Association a big shout out for the work that they're doing in terms of eliminating that maternal mortality rate. So, there is some good news.
Oh, there is. And I just want to hit you with one disparity and one marker in terms of the social determinants of health. In Ward 8, right now, only 42% of kids graduate from high school. Do you realize if I, as a doctor, got all the kids to graduate from high school, I would add 10 years of life to those kids?
Yeah.
It just shows you how powerful education is. And one final statistic, because I believe in statistics can be really boring, but if you have a few that are helpful, that kind of resonate. The other really interesting statistic of all the different social determinants of health that impact mental health, food is number one.
Yeah.
Food, not quality. I'm just saying any food affects the intensity, the severity of mental health issues, which we know that has gone through the roof during COVID.
Yes, and that's kind of been a sad statistic that I've noticed in terms of mental health and the dire consequences that stress and anxiety and depression can have. I've been noticing those numbers have been going up, particularly in Black and Brown communities, and that's not a good thing.
Well, especially among our young people.
Yes.
It's a crisis in our teens, especially.
Yes. But also on the flip side of that, I think more and more people are feeling and more empowered to seek help. And so that's the balance of it. So hopefully we can reach out, speak up and speak out. So, Dr. Gigi, I could talk to you all night. I promise you.
Hey, back at you, Mr. Ellis. Thank you so much. It's always so good
to stick around if you can.
I will.
We're going to do a discussion at the end, but I got to bring our other guests on. I'll tell you that's Dr. Gigi. She is wonderful. She is a gem. And we're just so thankful to have her on this program. But we also have somebody else that is not a stranger to Black Doctor. It is Dr. Keith Crawford. And he's got a whole lot of titles. But let me just say this. If there's anything, he is there. His boss is Dr. Anthony Fauci. You may have heard of him once or twice in your lifetime. And he is there. And he knows about infectious disease. He knows about vaccines. He has been there on the front lines. And so we wanted to have him on to really kind of break down these vaccines and variants and give you some really good information for you and your family. Because I've seen some of the comments in the chat box, but it is what it is. But what I want people to realize is that how serious this virus is. So welcome, Dr. Crawford. How are you doing?
Thank you very much for having me.
Always, Dr. Crawford, always. So I'm going to ask you, the first one I'm going to ask you is, how do vaccines work? Like, why are people so mistrustful of a vaccine that was created? And we get exposed to vaccines all the time. So can you help people understand how vaccines really work?
So basically what a vaccine does is it tries to trick your immune system. Your vaccine is going to take, some vaccines will take an entire virus or bacteria or fungus. It's going to take that organism, or it's going to take a part of the organism, and it wants to present that to your immune system so that your immune system thinks it is seeing the actual virus or bacteria or whatever the germ is that you're trying to fight. So it looks to your immune system like they're pieces of coronavirus floating around in your bloodstream. They're not, but that's what it looks like to the immune system. So the immune system gets revved up to fight it. What the vaccine is doing is teaching your immune system what the infection looks like. so that if you get the infection, if you get a real coronavirus infection, your immune system already knows how to put it in check. So it can shift into high gear. It can start making antibodies that can basically stop the virus from circulating. These antibodies can destroy cells that are already infected by the virus. And also it can activate a type of immune cell, what we call our cell-mediated immunity, which is able to go around throughout the body. These are specialized cells. They're just like tanks, and they go through your body and they say, oh, here's a cell that's been infected with coronavirus, and it kills those cells. So basically, it's a shortcut. It's teaching your immune system so that if you get infected with coronavirus, you already know how to do it. The virus isn't going to make you sick because you can produce the antibodies and the other protections so quickly.
Well, all right. So I'm going to translate that for people that sat in the back of the classroom like me. It's getting the cheat sheet for the test. Okay. And so your body getting a vaccine is giving your body the answers to the test before you have to take it. Now, you might not get the test.
I like that.
If you don't get exposed to the test, if you don't have to get the test, that's fine, but you still got the answers ahead of time. So that's for the GED folks in the room.
I like that.
So now we know how vaccines work. Help us understand how this particular vaccine got produced so quickly.
A lot of people have asked that question, and there are a couple of reasons why this vaccine got produced so quickly. First of all, I think many of us need to understand that it was an African American scientist, and she's been featured on Black Doctor, many of your events, and there have been articles about her, Dr. Kizzmekia Corbett. So she has done a lot of work. They had already been working on this.
Right.
And these messenger RNA vaccines are not new. People have already been working on it for other types of diseases. So what
haven't you been working with it with your HIV research? Wasn't it applied to that before?
So I can't think right off the top of my head of messenger RNA vaccines for HIV, but there are other types. Like if you look at the Johnson & Johnson vaccine, which actually uses, if you can believe this, another virus to kind of prepare your body to fight the infection.
Right.
We have been using a lot of those, a group of viruses called adenoviruses, and they're not harmful, but they can be used to transfer parts of another virus. So your immune system thinks it's seeing whatever the virus is. So we've used a lot of that for HIV. And then the Johnson & Johnson is used for coronavirus. So there are lots of different ways of getting parts of the virus into your body safely so that your immune system can recognize it. There was a question I forgot what
but so just, and I'm gonna give another layman's example is, so this company over here was building an engine.
You were asking how did it get done so fast? So part of the reason is that we didn't start from scratch with these messenger RNA. People had already been working on it. If you listen to Dr. Corbett, she will tell you there was only one thing that was missing, and that was the sequence of the virus. What is the sequence? The genetic code. Just like you have DNA, you have genes that tell you what your eye color is, what your skin color is, your hair texture. Well, the virus has genes too. Their instructions on how to make that particular virus. So when the virus was isolated and we were able to figure out what the sequence, what the genetic code of the virus was, Dr. Corbett could immediately take that information and plug it right into her process for developing the vaccine. So, a couple of things. One, people have been working on these vaccines for a longer period of time. Two, we channel all of our resources. So the federal government, my agency, the National Institutes of Health, other individuals, corporations, the US government brought the resources necessary to allow us to prioritize this. So this meant that companies could shift. They could put, okay, well, we'll put some scientists over here. We'll do this because they had the resources to do it. So that helped as well. And we were working on it together. There was a real drive. This is something really important. So there's a lot of cooperation going on in the scientific community.
Well, we got a good question in the comment section. So I'm going to ask this one. This is from Michelle, and she's asking, if someone was already infected with the virus, wouldn't their bodies naturally build immunity on its own?
Maybe. Okay. The question is, will it happen fast enough? We know that that happens for many people with the coronavirus infection. We know that as many as 45% of people who got infected were asymptomatic. They didn't even know they had the infection. Right. So that's what happened in them. They got exposed to the virus. Their body developed antibodies so quickly, and they were able to control the infection. But that didn't happen to everybody. Right. Some people don't develop antibodies quickly enough. So they get sick, but over time, their body wins the battle and they clear the infection. But in some people, their body loses the battle. They don't produce antibodies. They don't produce enough of the antibodies. They don't produce the right kind of antibodies. And the virus takes the upper hand and the disease progresses. And those people, unfortunately, succumb to the infection. So that happens as well.
Yep. So that's a good point. That's a great answer. And so that kind of leads to the next question, which is really about the variants. And so we've got a Delta variant, and now we're hearing, starting to hear something about a Lambda variant. Mm-hmm. And what I heard about the Delta variant, they called it coronavirus COVID on steroids. And so talk to us about the Delta variant, and then talk to us about this Lambda variant, what you know, because I'm just starting to hear about it. So I don't know how much you know about the Lambda variant, if anything.
Right. So let's start talk about the Delta variant. We've got a number of variants. The terminology is changing. People are probably where it was all this alpha, beta, gamma. You know, like Dr. Gigi is talking about. We got the whole Greek alphabet up here, you know, before long, which actually is a better system, because when we start saying this is the South African variant, or this is the Brazilian variant, or this is the Indian variant, this could lead to stigmatization of those people or groups of people because this deadly variant came from. The reality is the variants could pop up anywhere. There's nothing magical about India that we get the Delta variant from India. It probably did pop up a number of other places as well, but it was first recognized in India. So what do these variants do? And this is important to understand. From the time this pandemic started in the US, we had variants. Okay. We knew this very early on because we begin to see that the strain that some of these people got infected from Asia, from the West Coast, they got infected from Asia, And then some people got infected from Europe on the East Coast.
Mm-hmm.
And so people were saying, okay, well, these are different viruses. We knew that there were some differences. And then for a good part of the pandemic, we had a different variant. And this was a strain that we refer to in the scientists D614G or D614G variant. You're like, well, what is that? That's basically just telling for people who are scientists who care about this type of stuff where the mutation is. So this is a mutant virus, and it was the most prominent virus for a very long time. Why was it the most prominent? Because it replicates faster and easier. It's more transmissible. It is spread more easily. And that's what viruses like to do. Not only are some of them spread more easily, but some of them may be more deadly. So what we had this, what we called the British variant or the Alpha variant, which came into the country, and it started taking over because it could reproduce more quickly.
Right.
Well, the Delta variant reproduces more quickly than the Alpha variant does. It's spread more easily. It also seems to be more dangerous. And this is something that young people need to listen to. As Dr. Gigi mentioned, there's a group of people who are not getting vaccinated. Why are they not getting vaccinated? Because they don't feel like they're at risk for the disease. They weren't the groups of people who were laying up in the hospital dying. So they think that they're immune. Right. What they don't understand is these are different viruses. So people who are getting sick, people who are dying may be younger and healthier than they were a year ago because it's a different virus and it can cause disease differently than those other viruses do. So this is one of the big dangers of the fact that everybody is not getting vaccinated. We're creating this opportunity for other variants to pop up. And this is going to be a problem as long as we are not vaccinating everybody on the planet. We're all in this together. And let me talk about something else that isn't talked about a lot. And we have other tools to fight this pandemic than just the vaccines. We have monoclonal antibodies that are effective both for prevention and treatment of the coronavirus vaccine. These are some of the treatments that our president got last year. When he got sick, he went in, he got these products, one from Regeneron, one from Eli Lilly. These were very effective treatments and also very effective at preventing it. However, some of the variants seem to be able to get around these treatments. So they are not as strong against many of the variants. And this is a serious concern because these monoclonal antibodies are a good backup and protection for people who don't, for whatever reason, they don't get vaccinated, they end up getting sick. Okay, well, once you get sick, well, what can you do? Well, you can treat somebody with these monoclonal antibodies, but they aren't as effective against the variants. And so this is the problem that we're facing. We make all of this progress and try to turn this thing around, and then we could end up right back to where we were.
So just for clarification, the monoclonal antibodies, you have to be infected in order to be able to be to start that treatment. So it's not something that you can get monoclonal antibodies.
You could use them for protection also. So let's say, for example, let's say you didn't get vaccinated and your wife gets infected, tests positive. And so you're there and you don't want to get exposed, but you haven't been vaccinated. You could take the monoclonal antibody and it could protect you from getting infected. And some of these products are combinations of monoclonal antibodies. But now we are threatened with the fact that they are not as potent against some of the variants. So this is something of serious concern.
We'll keep an eye on that. We got a couple other guests we got to get to, but I got a couple of quick rapid fire questions because Pamela's been very patient about asking her question. She wants to know, yes or no, can you get the virus even though you've had the vaccine shots?
Yes.
Yes. Okay. And they're asking why. Daphne's asking, why was I down for a week after taking the first vaccination? She couldn't get out of bed. Is that just the immune system?
Probably a bit extreme. It's not unusual for people to have reactions to the vaccine, but they're usually not that extreme. I mean, when I got my second shot, I was knocked out for like a day, and then I bounced right back up. So
Gotcha.
It's not usually that long, but again, there's some variability. So I cannot answer that question.
It depends on your immune system and how your body responds. Sheila, I'm going to answer this question. How long would the vaccine last? As of right now, we don't know. We've heard anything right now from 8 months to a year. Pfizer is already developing a booster shot. So that is still yet to be determined as we get further and further out with more information. So, but right now it is still, the vaccine is still the best defense against COVID and against right now, at least the Delta variant, and they're probably going to be doing testing against the Lambda variant. But right now, your best defense is going to be the vaccine. So, Dr. Crawford, I'm asking you to hang around for a little bit. We'll ask some more of those questions. So keep your questions coming. We're going to ask them when we do our panel discussion at the end. But we got to get to our other guests. We've got some other wonderful guests that we're going to get to. But it's hard to we start with Dr. Gigi and Dr. Crawford. Man, this is a great program. And so I appreciate you asking your questions. Make sure that what we're asking are legitimate questions and not anything that's based in conspiracy theories. We'll address it, but we really want to make sure that we're asking legitimate medical questions because we're going to get those answered for you. Okay. Moving on. Next up, we've got Pam Grace Gashinge. I hope I'm saying that properly. I hope I pronounced that properly. She is the CEO. She launched, it's called Discover You Health. You're on mute, so I want to make sure that you go off mute before you start talking to us. But she has wonderfully accepted this invitation, and she's the CEO of Discover You Health. So the first thing I'm going to ask you is, what is Discover You Health, and what do you all do?
Yeah, so Discover You Health is all about encouraging adults and geriatrics, right, to pause and discover you, right? And so what that means is to really understand your health, right? What is your health history? What does your family health history look like? What type of quality of life do you want to have? And how is your health impeding that? And what can we do? What type of ecosystem do you need to create in order to experience not only optimal health, but also an improved quality of life? And so Discover You Health really does that by creating an ecosystem, a team, right, of individuals that really are there to provide concierge healthcare services. So this month, July, we're launching our concierge medical services. So we come to you, come to your home in the state of Maryland or the DMV area. You're also able to utilize telehealth as well as also come to our medical office as well. But the idea is to really remove any of those social determinants of health and really being able to make sure that healthcare is accessible and easy, but also that we're able to spend quality time to really understand what are those key barriers and what is the misunderstanding that's existing, and being able to kind of put the pieces of the puzzle together and then also be partners in our clients' health, right? So we want to walk with them in this life journey and this health journey and being able to support them every step of the way.
Well, sign me up.
yeah, for
sign
sure.
me up.
That's what we're doing. Membership.
I have heard about.
Yeah. Yeah.
I have heard about these services, and so we talked to a young man in Texas, and he was doing very similar in terms of concierge services. And so, correct me if I'm wrong. These services have been in place for a while, but to this point, it's only been enjoyed by like executives, company executives, high-end medical professionals, things of that nature, where they're getting concierge services. But now, companies like yours are getting them to everybody, so you can have somebody come to your house.
Yeah.
Do your physicals, get all of your health care at home. So you don't have to go anywhere. You just got to sign up for Discover You Health and they'll come to you. I love it. I love it.
Yes.
No more time in the doctor's office for me. I'm all for
that. That's the thing in the past, like especially with COVID, that has really shown us the value of time. Like we are valuing our independent private time so much more. And so what we choose to allocate time is really matters to us. So being able to offer convenience and accessibility, but also being able to have some value-based services is really, really important.
Absolutely. So thank you for starting. So we're gonna ask you at the end of the show. We'll put that on there so how they can get in contact with you with regards to Discover You Health. Have you been delivering vaccines? Is that part of your services, or no? Where people can call you all and say, "Hey, can you bring me a COVID vaccine?" Is that part of the services or no?
No, it's not. But we will happily refer you to places that are offering that and that have been throughout the pandemic. Yes.
Absolutely.
But what we are, I can say our differentiators that we're big on advocacy and health literacy, right? So we want to be able to promote our clientele to learn as much as they can so they can be engaged participants in their healthcare journey, being able to ask the right questions, being able to make strong and decisive decisions that once they make it, they feel good about it. And there's a sense of calm and a peace. And there's a level of autonomy that we want to be able to build up within our community. So yeah. That's
absolutely. So health education, concierge services, really about empowering the individual to take charge of their own personal health situation and history. And I think, if I can speak, Kendall, you can tell me if I'm wrong. It kind of feels like, Black people have been historically kind of really hesitant in terms of going into medical practices and offices. But if you're coming to us, if you're coming to where we live, we might be more engaged, might be a little bit more apt to utilize those services because they're coming to our home. And so you feel comfortable and, you might be engaged more in the healthcare services. And the more engaged, the earlier you can become engaged in healthcare, the better your health outcomes are, as we all know. So
Exactly. And I think it's just about not the drive-through healthcare system sucks, right? And so you really are not able to garner trust. You're not able to ask the right questions. You're not able to be heard. And I don't think it's that people don't want to engage or want to, for those who have not participated in a vaccine, is that there's a lot of outstanding questions, right? And they're not being answered in a way that person can process and comprehend. So when there's that gap and no one is spending that time or feel that person is valuable enough to provide that, quantified time, then they feel a little bit like dismissive. They dismiss that current messaging. So the current messaging that has been provided has been effective for those who have. And then there's a segment of our group where the messaging has not been effective. And I think where it's not been effective is more that personalization, right? Really meeting people to where they are, really being able to speak in their language, really having people that look like them, not just images where they're saying, okay, this is just another propaganda, but really being able to have someone that is tangible, that's in their community, that can really bring some valuable facts, and where they don't feel like they're being sold something, because people, when they feel like they're being sold something, especially when they don't want to buy, that's what you don't want to buy. Your guard is up, right? And so you have to look at it as like, they've been selling the vaccine to a big group of people, right? And so it's like, I don't want to be sold, don't come to my door. But the moment that you do have someone ear, even if they're not interested, you have to be willing and available to answer their questions and kind of go through those different hurdles or barriers, or being able to have some rebuttals, not just quick rebuttals, but rebuttals that make sense and that fit where that person feel like they're heard and understood. And then it can just kind of bring that guard down to the point that they can be able to, okay, you answered all of my questions. Now I can make a clear decision on whether to move forward. And either way, yeah.
It's interesting. What I like about your services is that we all know that when COVID hit, when the pandemic hit, and basically the earth shut down for a period of time, other medical services took a hit. People weren't getting their diabetes checked. People weren't getting their high blood pressures checked. They weren't getting their cancer screenings. There was a big impact on other medical services. However, with your service, they can engage and get those services taken care of. They can get their diabetes, their high blood pressure, their screenings, whatever they can get done at home, and still keep up with their medical services without having to go into an office if they don't feel comfortable because of COVID. Whether they're vaccinated or unvaccinated, they can get that concierge services in their home.
Yes, that is correct. That is correct. And one thing I just want to state that's a key differentiator is that I've been in the home care space, so more like post-acute care for, over 12 plus years, right? And so that is a private pay luxury service, right? Where we're coming to your home, we're caring for you, you are paying out of pocket, there's zero insurance coverage, but you do get that quality time, et cetera. Right. But being able to, again, diversify and being able to say, hey, people are willing to pay, it doesn't have to be, whatever pricing, people are willing to pay for quality. Right. And so I think it's like not discounting healthcare, as just this one size fit all approach, but being able to really tailor services because someone wants that tailored. They're willing to pay for tailored Jordans, or willing to pay for this, or willing to pay for a high-end luxury vacation, of course. But they want to feel like it was custom for them. They want to feel special. They want to feel included. And this is what the service provides. And then also they want to see outcomes, right? And so a lot of times, I think healthcare has failed when there's the outcomes either are not properly articulated, or that people know how to adhere, right? Or there's issues with adherence when it comes to other life stressors or family stresses, and like all of those moving parts kind of impact the outcome. So it's like, how can we iron out those key issues to really get you to where you want to be? Yeah.
Well, I promise you, this feels like, like Uber, it was an industry disruptor with regards to transportation. I feel like this concierge services being available to more people is an healthcare industry disruptor in a good way, right? In terms of getting more people engaged, getting better outcomes, getting more adherence to medical services, because they can feel more engaged and empowered to have somebody coming into their home and really have a consultation versus just drive-through, as you referred to earlier, drive-through medical services. So absolutely, I love this concept. I love this idea. I want you to stick around because I know people are going to want to ask you some questions. So I got another guest I got to get to, that I promised to get to. So hang around for me, and we'll have our panel discussion at the end of the program. So this has been a wonderful discussion. We got one more person. This is crazy. I'm sorry. I'm really, really excited about tonight's discussion. I hope you are too. So again, keep your questions coming in the comment section, and we'll get them answered, especially when we come back, when we bring back Dr. Crawford and Dr. Gigi, and we'll get those questions answered for you. But next we have Ms. Cheryl Howard, and she is a citizen there in the state of Maryland. And also she did something very, very unique. So I'm not going to mess up your idea by trying to explain it to the folks. So tell the people what you decided to do in terms of your fight against, helping the fight against COVID and coronavirus.
Well, first of all, thank you very much for having me join this esteemed panel. I really feel honored to be here today. I created something called Flip the Script, Vaccination, and it's a documentary on a mission to save Black and Brown lives from dying of COVID-19, with an integral component being a candid roundtable discussion, which is virtual, between Black and Brown healthcare professionals and the Black and Brown community. It's already just heartbreaking to see how many lives, we're at 603 at this point, that have died, 603,000 people that have died from COVID-19. Okay. And read then further is that Blacks are 2 times more likely, Latin 2.3, and Native American 2.4. That's alarming. And I, very much some of the things that I'm already hearing from the other panelists, meet us where we are. And this be a by us and for us conversation. I think it's so much easier for me to digest information when I feel a connection to the person on the other side of the room, when I feel that a person has an empathetic ear. It's wonderful, it's necessary to have empirical mind to understand science, but it's also necessary to have a person that you're getting or receiving the information from, in my opinion,
Right.
to actually not just understand your story, but to live it,
Right.
to be it. And that's what this roundtable was for. I've had persons like yourself and other doctors on the room and other
Right.
doctors like the other physicians in the room attend the first of many discussions to come. And the feedback that I've gotten thus far has been phenomenal. People felt in this virtual setting like they were meeting with a physician
Right.
that actually cared about them. And for me as a patient, it's about a voice of caring. I want to know that they understand when I walk in the room what I'm there for. I want to know that they actually care about the individual that's talking to them. And I
Right.
also want to know that there's some resolve. The truth is, there may be some of us that may not get vaccinated. But if we walk into a room and we feel like we're respected for our positions, we even dabble a little, maybe to your chagrin, Mr. Ellis, we even dabble in addressing some of the conspiracies. And we're not necessarily trying to go down a rabbit hole, but we want to acknowledge and respect the positions that people have. Personally, if I'm having an exchange, a conversation with an individual and my position isn't respected, I'm less likely to receive the information that they're sharing with me. So
That's
that's
true.
what this is, to really accept and respect and acknowledge that, yes, these disparities have existed since the beginning of our time here. And so
Right.
let's acknowledge that and understand that that's a part of why there's vaccine hesitancy today.
So I'm hearing some key words from you: empathy, respect, acknowledgement. This seems like passion for you.
Oh, absolutely. As a woman of color, as a Black woman, seeing the bodies that are being carried out of these spaces, the people on ventilators, and knowing that, like I said, we're twice the rate of our white non-Hispanic community members. This is alarming. I mean, and how much longer will this continue to go on? Just to have an equal voice in healthcare, in education, in food. I heard Dr. Gigi earlier say, not good food, just having food.
Right.
So what could I do? What little step perhaps could I make? What grassroots effort? And since I've been working events for years, during and since college, it was easy to put together what I guess the framework of an event, the template of an event, but actually talking to the community. I'm a member of the community. I'm not a member of the medical community. I'm a member of the Black community. And so let's talk to each other. Let's just have a real conversation, quite like what we're doing now, where patients, if you will, or people are able to really engage their physicians.
Well, I applaud what you're doing. And when is your next one? When are you having your next event? How can people be a part of that event if you're uncomfortable? And I'm promoting that event because you're right. Not everything works for everybody. So everybody doesn't come, and we've had some great success here with blackdoctor.org. I'm not even going to discount that. The Black Coalition Against COVID has had wonderful success in getting information out there, but it's not for everybody. Everything is not for everybody. And so if they don't feel more comfortable coming to your event and stepping into your event, I am encouraging that to get the right information. And so how can people get in contact with you? How can they become part of your event and join your event?
So as the date is still being determined, it would either be the end of this month or the very beginning, the first week of August. But I'd like to not put that date out there until it's absolutely locked in. But on Monday, the registration should be open. It's Flip the Script, FLIPTHESCRIPT.online. So as of Monday, you can go on there and register for the next event, by which time the date would be confirmed.
Well, absolutely. As soon as things go live, just let us know, and we'll make sure that we get that information out there, because we are all about getting people the information they need in the way that they want it, right? And so, absolutely, I do applaud your effort. I applaud what you're doing. I think it's incredible that a citizen that's not part of the healthcare community just decided, hey, you know what? I'm going to put together my own thing, because they care. And that's what this whole program is about. It's called Community Immunity. And what you have done, somebody from the community has said, you know what, I care about this community. I care about the Black community and brown and Native community. And so therefore I'm going to do what I can in order to save people in those communities from catching and dying from COVID. So
Yes. Thank you so much for having me.
No problem. So I'm going to bring everybody else back. I know y'all been waiting for this part of the program. I'm going to bring everybody else back. We got Dr. Crawford, we got Pam Griggs, and we've got, of course, Dr. Gigi. Man, this has been every time I've done this, and I'm going to be really candid. And I was like, every time I've done this, like, oh, that was my favorite show. That was my favorite show, because the people that we have had on here have been so wonderful, so open, such a great group. Not only acknowledged, but just really being transparent. And as Black people, we know if you're not transparent, we see that real quick. If you're not authentic, boy, we will run you off like Sandman on the Apollo.
Yeah.
We will get you out of there. So one thing I'm going to ask you this, Pam Grace, there has been a video that has gone a little viral here recently. Where they have taken some secular music and converted it to a vaccine song. And so for those of you who don't know, Juvenile and there was a song called Back That Thing Up. It was popular in the 90s, but now they have reprised that song and it's called Vax That Thing Up. What are your thoughts when you saw the video and when you heard the song? What were your initial thoughts?
I was like, oh no. I was like, oh no, they didn't. I was so mad, primarily because that was like a song of my youth. And so anytime, it doesn't matter if we are educated or what, if you hear Back That Thing Up, people taking their hats off, and we're acting crazy. We have no sense at that moment. And then we snap back. So I felt a little bit as if there was like a taking, like a robbing of.
It's a violation.
Yeah, it's like a robbing of like a memorable song, a memorable beat. Right. It was the same exact beat, same tempo. Yes. Everything was nearly the same, right? Just a little bit of the verbiage. So I think it just took away that joy factor. And then I was like, I had to hear and I was a little confused. And then once I heard the messaging, I was like, okay, I see what they're trying to do. So from a marketing standpoint, it was excellent. Having the original artist, there wasn't some other person doing the cover. It was original artist, original beat. So I thought that was very clever, and the messaging. But then I also thought it was very a turnoff for the people that are not vaccinated. I do not think that it promoted, hey, go get your vaccine, or hey, because it didn't come from an educational space. It just seemed really mindless, like a mindless approach. I did see the vaccination card from CDC, so I guess there was an endorsement there, that vax that thing up or you can't come around me. So, but it really bothered me, to be honest. But I thought from a marketing standpoint, it was clever. The messaging in there was clever, but from those who are not yet vaccinated, had some hesitation. I do not think it promoted or encouraged the masses, the ones remaining, to go ahead and get vaccinated.
Dr. Gigi.
Well, it's interesting. Look how much time you spent talking about it, though.
Right.
Yeah.
Right? So,
for sure.
What I mean to say, it got a reaction.
Oh, most definitely.
When we're talking about saving people's lives, with all due respect, I agree with the nuanced and wonderful points that you brought up rather. But perfect is the enemy of the good, and people are going to resonate with different messages. For us during the AIDS pandemic, it was no glove, no love. Right. Different people and different segments of the society are going to respond differently. For us, the Black Coalition Against COVID, we're actually having a specific campaign with PSAs to engage young people and to engage the hip hop community, different go-go community. For us here in DC, as you know, go-go is our official song, our official music. Right. So, I think it got our attention. It certainly got mine. And it is about engaging. So
It was interesting, when I first heard it, I saw the video, and I was like, much like you, Pan Grace, I was kind of like, man, that's a song for my legs. Like, you really just, I felt violated a little bit. I'm not even gonna lie, I felt violated. I saw somebody put a comment that it was insulting, but also I realized I wasn't the intended target.
Mm-hmm.
And so when I realized I wasn't the intended target, it gave me a paradigm shift with regards to the song. And sometimes as we get older, and I've realized that as I get older, I get more gray on my face than black. I realized that everything's not for me, and I can't look hindsight is 2020. I can't look with that condescending and that judgmental lens, because it's not for me. And so that song wasn't for me. It was targeting a younger generation that has been lagging behind in terms of getting vaccinated, that 18 to 35 age group that has been, slower to getting vaccinated, and it was targeting them. They say, hey, look, and basically the message was, if you want to get back out in the streets, you want to get out there and start mixing and mingling and getting acquainted with new folks, vax that thing up. So
I think that it's really critically important, as we had talked about earlier in my segment, Dr. Gigi's segment. There's this whole segment of the Black population, probably in Latino, other communities of color as well, that they do not see themselves at risk. Okay, so when we start talking about why do people not get vaccinated, and I also, Dr. Gigi, because I work at the Division of AIDS at the National Institute, that I worked in the trenches decades ago, so I saw every single one of those drugs as they were approved and came into clinical use, both the good, the bad, and the ugly. People, we have these different paradigms, these different models of health behavior, and what makes people engage in certain types of behavior. And part of it is, what is the risk? What is the risk? Do you think if you're 25 years old and you're smoking cigarettes, do you really think you're going to get lung cancer? I mean, seriously? Are you really concerned about something that might kill you 30 years from now, 20 years from now? These are the things that make it difficult for healthcare professionals to target people if they do not perceive the risk. And people do not perceive the risk, even of these Delta variants. We try to get the message out that this is a more dangerous virus. Yes, it will put you in the hospital. Maybe last year, the variant we had last year, the D614G variant, maybe that ain't gonna put you in the hospital, but this one surely will. People don't understand those nuances. They do not perceive the risk, and they don't feel threatened.
If I can just jump in, because I think that is such an important point. And that, in terms of tobacco, which I think has been more effective in terms of getting these messages across, it was if you kiss somebody who's a smoker, you're kissing an ashtray, right? That was one of the PSAs. Or how, your clothes smell, or you're going to get holes in your clothes, right? For the whole vaccine thing, you're right. The approach has to be different. Are you going to be able to travel? If you can, are you going to be able to go to school, right? Because increasingly more and more places. But I think another thing that we've not been doing a very good job on, sort of collectively, is emphasizing. Sometimes we, in physicians, we can be, oh, it's either this or this. You're either good health or you're going to die. Right. Well, let me tell you, taking care of some people with a long haulers COVID syndrome, that is no joke. I just saw a young lady. She's in her 20s. She can't run. She feels this. She was sick, I want to say back in September. She still has fevers and chills. She still has chest pain. She still has shortness of breath. She's got zero energy. So I think, we can, and I include myself, I mean, this is self-criticism, right? I think that we can just be sort of give the array of issues. And then there's also the practical ones because we don't know what's going to resonate. And also, when I see somebody, and I just saw somebody recently, a grown man, I won't say how old, not in the demographic. And I said, okay, did you get your shot? No. I said, well, why not? He goes, I'm afraid of needles. If you will come and hold my hand, I said, okay. But I'm afraid of needles. I said, okay. So, even sometimes what we think is the reason is actually not the reason. He's just scared.
Right.
Because he has to have somebody hold his hand when he gets his blood test done, right?
Oh, wow.
So, but I have to tell you, I've been educated. I have learned a lot. The reasons can be as different as all of us are. Yes, there are definite themes. And remember, when it comes to how we make decisions, it can be a process, right? We may say no way, and then we'll say, okay, just like again with the smoking, when you're trying to make a decision to quit, something will happen and you're like, oh, you know what? Oh, maybe the cost or something will resonate with you. So.
Yeah, I think so. My next question, that's a wonderful point for Dr. Crawford and Dr. Gigi. So, Cheryl, when you see across the country, there have been a number of programs to get people vaccinated. There have been ticket giveaways, there have been lottery entries, there have been gift cards. Even in some states, they've been giving away marijuana cigarettes in order to get people vaccinated. When you hear about all of these different programs and free giveaways just for people to get vaccinated, do you think that makes people more encouraged about the vaccine or discouraged?
I think that's a mixed bag. It's all up to the individual. Some people will be drawn in by it and say, oh, well, I don't have to pay for my, joint. Other people may feel offended, but if collectively we I don't want to say throw everything out there, but if you try many opportunities, I won't say strategies, but many opportunities for the message to be expanded to the greater communities, and they land with some that may not land with others, I think we have a greater, they say there's strength in numbers and volume, right? Right. An actor may go on 1 million auditions, but book one. So you want to cast as many messages as possible, right, so that you get as many people vaccinated as possible. And hopefully in those messages, especially to people of color, that it's truth and transparency, and it's coming from a place of love, a voice of caring, and I think that as many options that are out there, let's try them all. I may not agree with all of them, but someone does, and someone was standing in that line, right? So it's working, right?
Oh, somebody got a gift card and a joint. I'm telling you, it happened. They didn't do it because it didn't happen, and so I absolutely. I mean, I was on I think I was producing another panel. And they were talking about doing a TikTok. It was like a contest, and they were doing a TikTok. I think it was just in the state of Alabama because they're trying to encourage more young people, and they realized that they've got to meet young people where they are. One of the things that we realized very early on is when I started talking to younger people, and I asked a very poignant question: how many people somebody that died from COVID? Nobody raised their hand. How many of you all know somebody that survived COVID? All of them raised their hand. And so that's their perspective from somebody that's younger. They expect to live. And so therefore that reduces the urgency when it comes to getting vaccinated. They're like, my friend had it. He quarantined for 2 weeks. He was back on the streets with us, right? And so it's not a big deal. Where somebody that's older may have had a grandparent, a friend, somebody, they know somebody that has died from COVID or been severely ill by COVID. And so therefore it becomes more urgent as we get older. And so therefore, as you can see by the numbers, older people are getting vaccinated at a much higher rate than younger people. And so you're right. It's about the messaging. We've got to get the right messaging to reach younger people and to create a sense of urgency, because urgency makes people move, right? And so we all know that urgency makes people move. And so if it's not urgent for them, so that's what Dr. Crawford, Dr. Gigi's talking about. If it's not urgent, why go do it? But I think the variants and that younger people are now catching that variant at a higher rate, are getting hospitalized at a higher rate now. That may start creating a sense of urgency amongst many of them to go get vaccinated. So, because they don't want to end up like, they might know somebody that ended up in the hospital from the Delta variant versus the Alpha, Gamma, whatever we were having last year, whatever sorority fraternity we had last year. We're going to make sure that this Delta variant is putting younger people in the hospital. So maybe that creates that urgency that we need in order to get more people vaccinated. So thank you, Michelle. Right. So Michelle, I try, hopefully I addressed that. That was a nice comment you put in there. Hopefully we addressed it in terms of really talking about how those lotteries and prizes and things of that nature, it's not a gimmick. It's really about getting people to pay attention. And so if they hear, well, I can get a $50 gift card, I can get 2 tickets to a baseball game, I can get a joint if I use marijuana, and that gets them to pay attention to this healthcare, to this health crisis, then mission accomplished. And it's really about getting people's attention. It's not about gimmicks to get them part of some sort of experimental treatment. So,
incentives have been used very successfully in a lot of public health campaigns. And again, if we go back to HIV field, and particularly when I was doing a lot of international work, you could sometimes even give an incentive for people just to take their medication, or you give them an incentive to get tested. There are a number of very successful initiatives, and you got to do a cost benefit analysis. Is it worth us to put, you say, well, you mean you're really going to give someone, $20 to come in? Well, is that worth giving them $20, keeping people safe? Or would you rather have the cost of whatever this medical condition or whatever this medical problem is? And those costs are complex. They're not just healthcare costs, but they're social costs and other, very complicated issues. And so when you look at it, yeah, it is cheaper for us to give you $20 or give you a gift card or give you some type of incentive. Incentivizing can work. It can play a positive role. We do have good research that shows that.
If I can just also add, because I think that another theme is people also want to be taken care of in this urgent issue, but also not just one and done. This is an opportunity to engage and to see, stay engaged. That's why, what everybody on this panel is talking about through the various programs and initiatives is that, I love Dr. Hargrove Howard, because I say the same thing. We are motivated by love. It is about love in terms of, we want to take care of folks. And it's not just about absolute number of years. It's the quality of life. It is, the we're taking care of somebody's child or father, mother, sister, brother, all of that. So, that authenticity of love and where we're coming from collectively is something that is felt, but we're not just going to be here for the vaccine. We're going to be here to take care of you holistically and to work with you and to advocate for you. And so I think also that's the difference. That's why, Mr. Ellis, at the very beginning, when you were talking about in the South, people come in that, you've never seen, right? Government telling you to do that. Well, that's why it's so important that we're all engaged, right?
Sure.
That we are part of the solution, because it's not just a one and done for us. This is the latest example. So.
Absolutely. Well, go ahead.
I wanted to add something in regards to messaging. When we're talking about the young population, we have to understand, I guess what makes it so complex to reach that audience is that they've been the great disturber, right? They've been disturbing the social construct, the political construct, like every construct that exists. They have been disturbing that. And so we have to stop looking at this as where they're parents and we're going to tell you what to do, because that never works for anybody, right? And there's a level of boldness that exists with the youth that they want to not only be engaged, they want to have a seat at the table. They want to be consulted. They're going to fact check. There's this thing called trust but verify. They will verify that. And I don't believe there's a level of ignorance. I do believe there's a level of a risk assessment they are making. I don't
Yeah.
believe that they're just out here frivolously or, just out here. I think that they are assessing things. They are studying. They can read. They're making these gadgets and creating these systems and being entrepreneurs. They know what they're doing. And they're also sharing and communicating with their community. So I think from my old experience of being a peer educator, I think it's being able to promote peers, not fusing them with our agenda, but allowing them to assess all the information and being able to be empowered in that way to where they believe in the messaging that they're sharing with their peers, right? And they're not going to be bought by a lottery ticket or this or that. That doesn't work for them. They're the ones that would get a job and leave a job. They don't care about the security of a pension or retirement. And so I think when we think about this audience or this group, we're willing to take that risk, right? And I think everyone is willing to take the risk. If you're taking a COVID vaccine, you're willing to take the risk. If you're not, you're willing to take the risk. We're all risk takers. It's all calculated risk to some degree, and we're all engaging to some degree, whether we have the conversation or not. To not engage is still engaging, so it's being able to understand that population and meet them where they are without that critical lens, without that dictatorship lens or that tone of you have to do this. Because urgency doesn't mean importance. Your urgency is not my urgency. Your agenda is not my agenda. So what? And then it's like they've also lived through, the social injustice and everything. So even my son is 12 years old, but
you've got a 12-year-old son.
Yeah, I have a 12-year-old son. Yeah, but he is so hip on all the news. He teaches me everything. So we have to not utilize our own lens of understanding based on where we were at that age and compare them, because it's not the same piece. It's not the same thing. So
well, if I can give, I think that what you're saying is profound. And if I can give an example from the AIDS, my mom and I actually wrote an introduction to the Black anthropology issue dedicated, this is back in the day, to AIDS in the Black community. And guess what? Among young people, they're saying, well, why aren't young Black men wearing condoms? It's like, well, they did a risk assessment. If I'm going to die before the age of 25 of gun violence, who cares about AIDS, to your point? So I think that these are really just so, see, this is the thing. This is why I love these panels, right? Because we're really getting into the heart of the matter at a level that's real. Right. And so, of course, and we're, some of these lessons are lessons relearned, but you're absolutely right. The people that should be in the bus, driving that bus are not us. It's whatever group we're trying to reach.
Yeah. And I think it's just a relationship.
You just triggered me, because I'm thinking about like my own children, and I'm like, I tell them something, I tell them something, I tell them something, I tell them something, I get this. And then 3 weeks later, I'll get, Dad, such and such and such and such. And they got it from their friend. And I'm like, well, I just told you that. But I have to realize that they have to process it in their way. And they try to get it from their sources that they trust. And so, and while it's verified, what they're saying to me when they tell it back to me is, I can't get offended how they got the information. I just got to be happy that they got it. And so therefore, that's what when we're talking about vaccinating that thing up or giving them joints or beer or tickets or whatever, we can't get all caught up in the delivery method.
Absolutely.
But the fact that they got the message. And so that's really, so thank you for that, Pam Grace. You just gave me a word right now. I promise I can talk to you all night. I promise you, we're over an hour. I'm going to say something. I'm not being facetious. This is my favorite panel. this is
we'll see what you say the next one.
Don't watch the other video. Don't watch the other one. This is my favorite panel. So as we're wrapping up, we're over the time that I promised you all. So as we're wrapping up here, there's one thing I'm going to do that's a bit housekeeping, and then we're going to get everybody's final word of the night. But I do want to put this on screen for everybody. If you're still with us, you're watching us, we would like to get your feedback. So your input is important to us. So please take a moment to answer one or more of the questions below, and you can post your response in the comments. Which speaker resonated with you the most? What information was most helpful for you? And did this event help you feel more informed or confident in making a vaccine decision. And so please put that comment, answer either one or all of those questions in the comment section. We'd love to get that feedback from you as we're wrapping up this program this evening. And so I'm going to ask everybody for their final kind of comments. We're going to go in the order of appearance. So Dr. Gigi, you're up.
We love you. I love you. And that's why I'm here to try to convince people to take the vaccine. If you don't want to take the vaccine, I still love you. That's it.
Absolutely. Wait, what just happened? And Dr. Crawford.
I'm going to go to something that Dr. Gigi said at the very beginning. In the state of Maryland, the people who have died from COVID-19, none of them were vaccinated. Fewer than 1% of vaccinated individuals have died from COVID-19. These are some of the best vaccines we have ever had. Please think very seriously about getting this. We can only shut this down if everyone participates. We're all in this together. The variants can push us back and can cause some problems. So think very seriously.
Absolutely. Pam Grace.
Yes, thank you so much. And I want you to know that trust but verify, meaning trust yourself. Know that your thoughts, your concerns, your beliefs matter, and trust your instinct, trust science, trust your doctors, but more importantly, verify everything and make a sound decision that honors you and that you are okay with the outcome. If there's any casualties, that you have peace with yourself and you trust that decision. So just trust but verify.
Absolutely. And Cheryl.
I mirror what everyone has said, and the reality is there are 603,000 people that have died from COVID-19. And there may be some physicians out there that have shared that it may be here for a really long time. So the reality is, if we are not vaccinated, where we have close to 95 or more % protection from the vaccine, then we have zero protection should we catch the virus. So yes, trust but verify. Open your minds and your hearts to individuals that truly do care about you, like the panelists on this call, and make a more informed decision. Hopefully that decision is to get the vaccine.
Absolutely, absolutely. So what I'm going to end with is this, is that I'm always going to ask you to seek information and not affirmation. And so you have to go to this with an open mind. You have to seek the information that is from verified and trusted sources to help make a more informed decision. Yes, everybody on this panel, most people, when we've had these programs, have been proponents of people getting vaccinated, but we're also proponents of you making decisions for yourself and for your own health. And so that's most important. So I know sometimes we come across a little preachy, and you can kind of feel that proverbial finger wag that's happening when we're talking about getting vaccinated, but that is not what we're trying to do. What we're trying to do is give you the right information, the proper information, give you the right, and one of my favorite words is context. We're trying to give you the proper context when it comes to your health decisions. And this vaccination around COVID is a health decision. Believe it, believe us all on this panel. It is a health decision. No decision, indecision is a decision. And so just understand that as well. So again, I thank everybody. I think all my panelists, y'all have been wonderful. Thank you all for joining us. Thanks for being with us tonight. The people in the chat room, in the comment section, y'all have been wonderful. Thank you all so much. Even if you had an opposing opinion, I love the fact that you put your questions and your comments with a spirit of love and trust and really trying to get an understanding of what's going on. That's the approach that we all need to take. If we could take that approach to political and other medical conditions, we'd live in a much better better planet. And so I continue to ask you all to just keep going on with that spirit of commonality and love, and just really trying to seek understanding. Thank you all for joining us this evening, and we will see you